Boom Bop Pow. Welcome back to the Point Taken Christian Podcast. This is the podcast where we make and take spiritual and biblical questions and chat them up. Today, guys, this is a topic with which you may disagree heavily. Maybe you agree heavily. Either way, it's probably pretty controversial. As far as healthcare is concerned, there's a lot of differing opinions, a lot of which are felt strongly, but what is it really based on? That's what we're going to be talking a lot about today. We're going to be talking about modern medicine versus holistic medicine. We're going to be talking about immunizations and sources that you can look into to better educate yourself on these things. And maybe this is kind of a difficult topic for you. Maybe you feel very strongly about it. Don't ignore it. Just remember, guys, that in 1 Corinthians 6:19-20, we are given pretty clear instructions that our bodies are a temple. And we are stewards of that body, just like with everything in this life. Nothing is ours. Everything is God's. And as stewards of this body, it's our responsibility to be taking care of it and to educate ourselves in whatever way possible so that we can do what we are supposed to be doing. In this episode, we have on Lauren Vance and Jake Romo, two people highly educated in this topic who are going to be helping us course through some of these issues. So without further ado, let's get into the episode. You said holistic medicine versus modern medicine. What's the difference between those two? If you were going to define holistic medicine, how would we say that is?
I would almost say like alternative, and I don't even like that terminology. We used to have a belief that in general you took care of your body, you ate well, and you knew how to fuel your body in a way where it could largely heal itself, and that medicine was there to fill in the gaps. Okay. Either injury or illness, it was there to fill in the gaps. And, the breakthroughs of modern science were there to prevent the plagues of biblical times, and that was kind of how it was viewed. And in general, in many ways, I should say it that way, not generally, but in many ways, I think there was a time when we had a much healthier overall. We were a lot healthier.
Okay.
We were a lot healthier from person to person, and now we have, like,
around
by
what
and
time
large,
period?
almost the majority. I mean, I'd just go back a few decades.
Okay. So like the 50s, 60s.
And with the caveat that obviously medical advances have been made, both in, technological treatments and medicines and a bunch of other stuff. But the general attitude about medicine in this country has become so... It's two things, the way I see it. And I think, so the other side of that definition, modern medicine, would be like, something's wrong, a specialist must fix it.
Okay.
So anything's wrong, we at least need a specialist to look at it. And I think there's something wrong-headed about that in general. So the general attitude that I'd take umbrage with is kind of, here in the United States, we have very push-button problem-solution type thinking. So there's a problem, so push the solution button. My pipe's backed up. Plumber, right?
So it's like a medical vending machine, just like whatever's
Kinda,
wrong.
and that's how we kind of see a lot of stuff, right? Something's
what
broken
would
in the
be-
house. The first thought isn't, hey, what can I do to maybe try to fix this myself? Maybe more so in the last few years, given certain circumstances where everybody was stuck at home for a while.
Yeah.
That's maybe shifted a little bit, but in general, like, that's how we think.
Call a guy.
And we apply that to medicine too. And then on top of that, a general, an increase in illiteracy, and that includes scientific illiteracy, and therefore medicinal illiteracy. People don't know how their bodies work. People don't know what science does, let alone what different fields of medicine do. And there's other issues too, as far as I see it. If you go to the medicine side, people are so hyper specialized because the fields of study have gotten so big, they've branched off so many times.
Yeah.
You don't just go to an ear, nose, and throat doctor anymore. You'll have a bunch of ear specialists, nose specialists, and throat specialists. Like, that's kind of more what it's looks like now, as opposed to days past. And that's just confusing to people. And anyway.
So,
it's a
but
bunch
your
of things.
personal belief on that, your stance would it be accurate to say that you prefer the more you should be more responsible for your own health, or?
Yes, I think people need to be educated. I think they need to self-inform on the limitations of modern science. I think people need to know inherent problems, and I think, again, that's become more apparent in a broad sense lately in the last few years. But the problems that we have internally, whether it's politics or corporatism or whatever, that's kind of messed with our medical system, but also what people can do for themselves. I think that we can do way better, and we have I think it would be accurate to say that is our responsibility from a biblical perspective, is to be informed, because we have the tools to be informed, and to take charge in our own health and the health of our families.
Okay, Lauren, would you agree, disagree, or how are we feeling with our stance on what is holistic medicine versus modern, based on what he said?
Most of it I would agree with. I mean, I'd say within the past 2 decades, medicine has gotten very specialized, and there is some disconnect with that. There's a lack of collaboration among specialties. There's many nuances. EMR is not communicating, a breakdown in communication.
In the EMR?
Like electronic medical records,
Okay.
which is where all of the information on patient visits, diagnostics, test results, all of that. If they don't communicate, there's a breakdown there. A lack of time for providers to be able to adequately educate their patients on the disease, the medications, the side effects, right?
Didn't you tell me one time there's you have an average of 20 minutes?
Usually it's
doctors
about
have 20 minutes?
15 minutes. So
15 for what?
for a patient visit, let's say a primary care visit.
Oh, so after all the waiting and all that, you get in, you see the doctor, and then you just you got 15 to make your
15
case and for
minutes.
them
The doctor's
to solve
got
it.
so many
Yes.
patients stacked up.
Yeah.
He's got
Yes.
an average of 15 minutes per patient.
Right.
To actually, okay, who are you? What's wrong with you? What conjure a solution?
That's kind of the normal now. I guess for
Yes.
me, I'm 27. That's been my life.
Yes. Yes.
Did y'all ever experience a time where doctors were spending more time?
I think the only time that was not the case was during both pregnancies. With both of my daughters, my OBGYN, she was definitely against sticking to the time frame.
Yeah.
Which of course babies also don't stick to time frames, right? But she was very intentional about giving each patient adequate time to address all of the concerns, and especially with brand new first time moms, that's really important. But healthcare overall, that's not the norm anymore. Other than that specific situation, it has definitely been more of a hurting people through mentality. And a lot of that is based on, profit margins for offices and things that insurances will and won't cover, and meeting certain quotas and standards. And so it's unfortunate. It hurts the providers and it hurts the patients. 15 minutes is barely enough time to talk about one problem. When you're talking about a patient who comes in and they've got high blood pressure, high cholesterol, they've had a recent heart attack, they've, many, many, many different comorbidities, it does not leave enough time to adequately educate patients. And I think that we're seeing the results of that with a lack of overall health for our population in this country. Because when, as a provider, you don't have enough time to go through the diet and the exercise. I may be able to give you a a sheet on it, I may be able to tell you where to go look it up, or to tell you to set up an appointment with somebody else to talk about it. Which that's
Specialist.
Specialist, right? Go see a
nutritionist and
nutritionist. Go see a dietitian. Go see someone an endocrinologist who specializes in diabetes and medication if you're struggling with this. And so our country...
And get 15 minutes with them as well.
Right, right.
If you're lucky, if you don't get the nurse practitioner.
Yeah, if you're
instead.
lucky, right. And, so we have to find quick fixes. That doesn't leave a lot of time to invest in patients like we should and we want to. I don't think it's a problem with most providers not wanting to adequately educate. I think it's a lack of ability because of the time constraints.
And those time constraints, is that due to lack of medical professionals? Is it due to general unwell-being of the population, or is it due to more of this stance of specialization and all that?
Well, plus, obviously, like, if everybody is, I got the sniffles, I gotta go, right?
Sure.
You have a lot of people, I mean, I'd venture to say in my uneducated self, 9 out of 10 people are going to doctors when they don't need to, and it's just clogging the system. That's certainly not helping anyway.
Yeah, that's true. Not knowing when to go to the doctor, when not to go to the doctor, I mean, that definitely causes issues.
And that's more to Jake's point of understanding your body and understanding health and all that.
Right.
Which I'm on the opposite end of the spectrum. My people have to force me to go to the doctor. I'm just like, I'm fine. I know my body. I was taking ibuprofen. It'll be gone in a few days.
Right. Well, and back to what you were talking about, what's the issue? Well, there is a shortage of healthcare professionals. There's a shortage, especially in primary care. And because of the burnout. I think within the past couple of years, they did a study on physician assistants and nurse practitioners specifically, and the burnout rate was something like over 60% within the first year if you were in primary care. Those aren't good odds,
That's pretty bad.
and it's because of you never clock out. If you're in a typical day, say 10-hour day, and you're seeing patients, 15 minutes per patient, which is not enough.
Right.
And
But
then
10
after
hours of
that,
that.
right, then you've got a chart on all of the patients. Then once you order the labs or the testing, then you have to review it, interpret it, all of these other things, and trying to catch up on that. And it's really hard for people who have families to try, and there's just no balance there. And so people get burned out.
Because some of these people are really sick and need that, snappy.
Yes. And so, I mean, do you live to work or do you work to live? And so there's not a lot of balance there because it's so daunting, and there's just not enough time, and there's not enough providers. And so what do you do,
So if we were to, because we've gotten a lot of discussion on it so far, but just so that we can reference it back in the conversation, if we were to have a sentence or whatever, a hard definition of what is holistic medicine versus what would modern medicine mean, how would we say that? Just to frame our
I think that has
conversation.
more to do, I would say that more has to do with the individual's attitude.
Okay.
That having the attitude of, well, I'm leaning on the technological, the medicinal technological establishment for everything that has to do with my health, versus an attitude of, I'm going to lean on my, at least I'm going to take charge in my health, and I'm going to be healthy, and I'm going to be a critical. Because, I mean, at the end of the day, our medical system is it's a consumer market. At the end of the day, that's how it is. Am I going to be a discerning consumer? Because you do not have to be a specialized scientist to read a medical study.
Okay, yeah.
True.
I've read some, but I'll top it, but I've read some really technical chemistry papers where I didn't understand a lot of the specifics, but I could understand the logic and the conclusion. I can tell where there was hey, that's not what
The
that's
basis
not
of what
that's
they're-
not a valid statistical variance, or like that's a more technical term, but like, hey, that's not a valid logical conclusion, you know. And that's way more convoluted than a lot of medical studies. Those are plain language by comparison most of the time.
So would we say holistic medicine is more the individual's consistent pursuit of health, using medicine as a supplement, and modern medicine is an individual's reliance on the new advancements or specialists or anything like that? I don't want to make it sound like modern medicine is just like evil. But I'm
And
just,
neither would we.
yeah, no,
Yeah,
and we
neither at
don't.
all.
I think we both agree that that's not the case. I mean,
Yeah.
we have come so far in being able to prevent disease.
Yeah.
Being able to, adequately diagnose and treat patients and to tailor treatment specific to patients. And that is a miraculous blessing that we have today versus just 100 years ago, right?
Take just trauma medicine, right? You come from like the military side. You go back to World War II, and you had so few wounded vets returning home because 90% of the battlefield injuries, they would die before they got back home. You come up to Vietnam, I don't remember the numbers, but it's like 65% were not making it off the battlefield. It was better, but you fast forward to today, and there's political discussions about having so many wounded vets on basically military medical care because 90% of them are coming off the battlefield alive.
Man.
Right? Case in point.
Right.
Some pretty
To the audio only.
No, but so way worse injuries than I have.
Yeah.
Coming off, and they're living a full life. And so the proof is in the pudding with trauma medicine, right? And that I
With
think
that,
goes across the
and
board.
with our specialists, I mean, you look at the argument for universal health care and how everybody wants, like, hey, we think healthcare should be right, all that. The biggest pushback in America is the value of our specialists. Just like you can't, it's like, it's hard to say, well, yeah, the government can supply you the same amount of health care that we already do right now. When you have all these specialists in America, people are coming all over the world. They need to come to Texas. They need to come to New York because we have the specialists in everything that are
Yeah.
extremely valuable and saving a lot of lives.
Well, and that's a good point. So Canada is a good example of a country that does have universal health care, and I've read articles where people, cancer patients, for instance, they can't get in to see somebody for 6 months. Well, if you have pancreatic cancer, that's a silent killer and it kills
Yeah.
quick. And usually by the time it's diagnosed,
You got 6
you're already
months.
advanced. Then they don't even get a shot. I mean, they don't get an opportunity to be able to extend the longevity of life or their quality of life because they don't have access like we do here. So that is a good point. And I think the holistic versus modern too, it comes down to responsibility. Am I taking some responsibility for my health care? And do I want to overall be healthier? And am I willing to educate myself on what that looks like? Or am I just going to depend on a healthcare provider to
Yeah.
tell me what to do? And if I don't want to do it, am I okay with just taking a pill and trying to find a quick fix? So,
Yeah, true. It's it's like a little adage. She's like, well, you can live for a price or you can die for free. But now, not to get too deep into that conversation, but it's like, it should definitely not be the price that it is.
Correct.
But
right.
But yeah, there's a lot of value to specialization, but none of that is going to work if you don't pursue health daily with your own choices. And if
Right.
you don't have a basic understanding of how things work, and like, how are you going to make a decision for yourself? If you can't see a specialist, how are you going to make a decision for yourself if you don't know anything?
Right.
Well, and like I said, it's a general attitude thing.
Yeah.
I went to the VA a few years ago, and they said, hey, your blood pressure is not high, but it's higher than we like for your age, so we want to put you on a couple medications. And they go off for 10 minutes about, what the medications are going to do and all this other stuff. And then they're almost like, and then there's diet and exercise. And then they go right back into talking about the medications. And then I literally held my hand up. I'm like, hold on. I was in the military. I know what self-discipline is. Can we start with that? Let's go back to that.
Yeah.
Let's go back to that one. It's like, well, yeah. Well, just most people don't want to do that. That's what they said to me.
Yeah.
And that's true.
Most people don't want to do that. And so,
yeah.
I just made a conscious effort to eat a little better and to be more active over the next year, and it was fixed. And it wasn't that big of a deal, right? But that was almost not part of the conversation. Like in my own head, like I was waiting for her to be done, and I was like, okay, well, here's what I'm going to do is I'm going to take care of myself. But it was almost not even part of the conversation, and I think that's indicative of the broader problem.
Yeah, and you've said multiple times it's about the people's attitude.
Mm-hmm.
It's about attitude. And, hey, look, I'm, culprit number one of not wanting to diet. I love to exercise in fun ways, but I don't love to diet. It's the worst. But I'll tell you what, I don't also really hate not having control. I hate not being able to say, well, with enough, picking up of the bootstraps and enough grit, I can get this done. I hate that. Like if somebody says, hey, this is out of your hands, you're just going to have to deal with this type of medicine, this treatment, that would crush me. Mm-hmm. But I feel like a lot of Americans would hear that and say, oh, good. This is like, oh, good. It's like, I'll just take this. I'll just take this pill and you guys can take care of this. And then it's like my future is in what? Like the hands of whatever doctor, is making decisions, or the hands of the pills that they're handing me, And a lot of people don't know anything about these pills. And they just take them on faith.
And a lot of the time, that doctor is not 100% sure. You think that there's like some, master encyclopedia somewhere that says this problem equals this pill, right? That's not how it works. Like they're making an educated guess, but it's a guess, and there's expected to be a follow-on and see how that's doing. Oh, we need maybe to up a dose, maybe switch medications. They don't know 100% either.
Well,
but the consumer mindset is, well, this didn't work. I demand my money back. I want a refund. Like that's how we think about it. So I think how we think about it needs to change.
Well, and a provider's ability to educate their patients is only as good as their due diligence in their research and staying up to date. And also, it's only as good as how good is the research, right? Mm-hmm. So is the research valid? Is the information that providers are getting to educate patients accurate? I think one thing that I have learned as we talked and prepared for this is that not everything that is put out there that has the word science attached to it is valid and accurate and is properly interpreted. But I think that we need to do a better job of having a healthy dose of skepticism as providers and as patients, and looking at things and learning how to evaluate things and to question, right? That's a huge part of our faith. We're supposed to wrestle with our faith. We also need to question and seek out answers, and to educate ourselves so that we can make better decisions. On the provider side of that, we need to do a better job of evaluating our sources and presenting. And you're right, it's just a culmination of the best information we have at the time, and that's subject to change.
In an altruistic world. And I think something that definitely needs to change about the American mindset is we tend to think of science with a capital S as being this altruistic entity.
Oh yeah, it's American's God
that communicates communicates perfectly and evaluates everything uniformly and comes to uniform consensus. And that's not how it works, whether it's medicine or anything else. That's not remotely how it is. People find stuff all the time. I mean, first of all, like that's just giving everyone the benefit of the doubt. Take human nature out of it, right? That, it's not like that even with that removed, right? There's studies done by flawed humans. Each individual human has to work. They can't sit around intaking all the studies that are coming in from around the world all the time. So they're limited in the information they can take in. But you add human nature back into it, and now you have situations like Professor A is over this medical school. Well, he built his reputation on a certain, certain findings. He came to prominence by a certain way. Well, science, by definition, the people from the bottom doing more research are probably going to invalidate Professor A's finding. Professor A doesn't like that, right? Because now he is his whole point of existence can be invalidated by the lowest level peon in the scientific rung. It's just how it is, right? There have been trying to be less controversial by sticking to medicine, but there's a controversy in cosmology, because one of the key things that validates the Big Bang model has been questioned for years, because anyone who can look through a telescope can make so in particular, it's the redshift. So people looking at the redshift, they can make observations with their naked eyeball at how galaxies interact with each other. And this may seem like totally off topic, but bear with me.
No, I'm here.
They can make basic observations with their bare eyeballs that, hey, wait a minute, if our concept of the redshift is true, this shouldn't look like this at all.
Could you explain redshift real quick?
Okay, so if anyone's ever been near a car as they've been laying on their horn, and you know how the sound shifts as it's driving past you,
Doppler.
Yeah, that Doppler effect. The oversimplification is that it's like a Doppler effect, but for light. Okay. And so as light is moving, a light source is moving away from you, the range of the color of the light will shift toward or away from red, and therefore it can be an indicator of how far away and how old that galaxy is.
So like a measurement for distance?
Sort of, yes.
Kind of.
Yeah, but more like an indirect inference as to age.
Okay.
Is the idea. So when you see two galaxies and they're clearly wrapping around each other, visibly interacting, but the two have wildly different redshifts, that shouldn't make any sense.
Right.
That shouldn't fit into that model. The redshift is held, just as an example, the redshift is held up as like a one of the key confirmers of the Big Bang model. And so that being invalidated is a problem for a lot of people. And there's a growing body. It was 1,500 in this particular club at one point, but there was a growing body of relatively low-level astronomers who have made observations to the contrary and just written a paper asking the question, hey, that's weird.
Yeah.
And fired, defunded, a lot of the stuff that we've seen in the medical industry in recent years for obvious reasons. That kind of thing happens. And it's not like some grand conspiracy. It's human nature. The guy who doled out the grant money was probably trying to fund confirmation of the thing that he built his own reputation on. So you have that to contend with, too. And that affects the medical industry. It's just another branch of science.
Yeah, that's definitely come up. Something that just following medical dogma and not taking the blinders off and seeing the big picture is something that I've been guilty of, that was glaringly obvious, and it should have been obvious, but trying to educate yourself, doing the right thing with the best intention, if you don't have all the information, it can still do harm to patients. Every provider takes the Hippocratic Oath to first do no harm, and this whole time you go through medical school, you go through PA school, you become an MP, and you're told that this is fact, this is true, this is what you follow, these are the sources you use, but not necessarily how to logically evaluate and to look for those biases. And I noticed as I was doing some research for today that I was reading an article in a prominent medical journal, and it was written by a doctor who had obvious biases. So this doctor...
And conflicts of interest.
Right, correct, was writing regarding immunizations and links of immunizations to diseases.
Like autism?
Yes.
Okay.
And so he wrote this paper.
What he means to say is undefined brain injury.
Yes, encephalopathy. So he's writing about this, and he's asserting that there is absolutely no correlation. However, he also holds the patent for an immunization. He's also employed by a huge pharmaceutical company. And so then you go, wait a minute.
Yeah.
Something's off, and the language in the article was ambiguous. A lot of the correlations were not backed by evidence or scientific papers that were noteworthy.
Yeah.
And so as I read that, it was kind of mind-boggling that here we are. I mean, a couple of months ago, if I had read that, I probably would not have realized that.
Wouldn't
But
have thought
looking
about
at
it,
it
yeah.
a different way made me realize I really need to be careful about how I critically evaluate studies.
Oh, I've learned a
Well-
lot about stuff like that because, there are things in there that he could have said that maybe were 100% true, but because of those biases and because of the position he's in, I'm always just going to say that whole paper is gone.
Right.
And-
Right.
But you could just as easily say like, okay, well, he knows what he's talking about because he's in that field,
Yeah.
and therefore,
And these are
he can
things that-
speak to the issue. But you can say the exact flip too, because during the recent pandemic, regarding the very popular but decidedly ineffective immunization. Before it really came out, just think of it as a category, right? That whole category of type of immunization, right?
Okay.
If I'm trying to keep the podcast on the internet, but it was a relatively new category of immunizations, right? If you
Okay.
don't understand what I'm talking
Correct.
about. Okay, so and I'll use his name because he's a public figure now because of all this, but Dr. Robert Malone immediately came out and said, hey, this is not the route we should go for solving that problem. We shouldn't even go down that route. In fact, we should look in this other category that would be like obviously repurposing over-the-shelf, over-the-counter medications because they're not patented. We can produce them really fast, really quickly. We should be hardcore looking over here.
What do you mean by repurposing? Just like altering
Like
them? Or
using-
just
There's a whole
using
field of
Using medications that are not necessarily FDA approved to treat certain conditions, but to repurpose them to use to treat a condition that it wasn't necessarily intended
Designed
to,
for.
Right.
Okay.
It's actually a standard practice if there's an outbreak somewhere that so ibuprofen,
Yeah.
for example, it has its primary and secondary uses, but there's also tertiary. There's other side effects and effects that it has. So there's a whole field of research that's like, well, if we mix ibuprofen with Tylenol at these doses, it can conjure a certain effect
Sure.
that you wouldn't have expected otherwise, and you don't need 99.9% of the time. But if there's an outbreak, it's super effective, right? And that's kind of a standard practice because it's available right now. It's available everywhere. It's not patented because the patents have run out, and so anyone can manufacture a crap ton of it fast, right? It's totally logical, right?
Was he pushing a specific medication to repurpose?
No,
the
but
idea of
not because it wasn't. He didn't have ideas at the time. He was working for DARPA in that realm.
And DARPA is.
The Defense Advanced Research Project Agency. Look at me.
Wow.
It's the military's 007Q organization.
Okay.
They're the ones who come up with all the new gadgets and weapons and stuff for the military, among other things.
They're
but-
Stark Industries.
Yes.
Okay.
Yeah. Anyway, he was working for DARPA in that category, but before that, he had come out of the medical field and gone into medical technologies, and he had created not just not just those types of immunizations. He started that whole field of science that led to that. Like, if there's one human being on the planet who you'd say has a right to speak on, that new type of immunization, it'd be that guy.
Sure.
For sure.
And he was the one saying, "Whoa, let's slow down.
No.
This is a bad idea for lots of reasons, and there's better ideas over there." And he was shut down as a science-denying quack, right? That's what he was called.
Science denying, that's where it's not science, it's God.
Right.
It's just their God, because it's like that's not following any of the scientific principles at all. It's not tried, it's not tested, it's not true.
Right.
Yeah.
Well, and we saw a huge disservice done to our whole country with the way that misinformation was propagated to fulfill certain agendas. And I think this is something that Jake and I agree on, is that the government should not have their hand in educating patients on medical decisions.
Yep. Or influencing those decisions.
Correct, because that is something that, if it had been handled in a way that was to promote the health of our country, the recommendation would be, we have this is what we know about it. Go talk to your healthcare provider to make an informed decision on what is best for you and your family.
Right.
Period. Nothing else. And that's not what happened. And there was so much misinformation and so many people speaking with authority on things that we really didn't know. And that's something that in medicine we should not be afraid to say. If we don't know, we don't know. And that's okay to not know.
But they're hearing from the government, you have to have an answer. You can't say...
And this is this effective, or this is that effective, and skewing statistical results to fit a narrative. And that's not sound science.
And we may not have known about the specifics, but how you manage patients with upper respiratory infections is a well-established practice.
Yeah.
And there's, the general concept of what's happening to the human body, people had some really good ideas about how to treat it. And so there was, in the politicization of that whole incident, but not just politics, but corporate mechanisms too. The lateral communication between doctors, hey, this worked, which is what you want when something really bad is happening widespread. That was shut down. One voice will be heard. There were doctors that prescribed things to their patients that they heard worked with another doctor. And because of political narrative, big name pharmacies would say, well, we're not filling that because there was a press release today that's not for, you can't use that for this. It's a horse tranquilizer. Right.
And pulling drugs for providers to not even have the option to provide it, or doctors and providers being blacklisted should they prescribe. There was a whole coalition that was formed during this time of doctors who their evidence was sound, and I mean, it was almost impossible to find the information in the research because it did not fit the algorithm and the narrative that was being portrayed. So
yeah, that's the biggest thing, is just like healthcare can't be politicized, because anytime there's any type of agenda that I can't trust is your survival, your health, your safety, then I just can't. Like, even if you end up being right and say this ends up being good, I cannot in a right mind trust that, because I have two things. I have scripture tells me to submit to the authority given unto me, which would have been at that time the president and all this stuff. But it also tells me that I have to take care of my temple in which the Holy Spirit dwells. And it also tells me that I must obey God over man. And so I'm sitting here and I say, well, at the end of the day, I have to do what is the right decision for my health the best way that I can.
Right.
And it's to not trust, the wolf,
Right.
Who's just very clearly lying.
Well,
Whatever the, goal was.
Right.
Bringing it back to the topic, though, like the whole reason that worked is because of the American mentality of, oh, there's a problem.
Yeah, okay. Yeah.
That person is the specialist. Give me the solution. People are looking
Looking to them.
looking for that, or at the very least, it was, even if people were more free thinking, it was easier to be pressured to push that button, right? Well, at least it won't hurt you. Just push the button anyway. You know. So I still think it comes back to an individual responsibility.
Yeah, always. If we are constantly pursuing a state of health and a state of non-ignorance and education, then, it's a lot harder it's a lot easier to pick out those wolves, and to see the lies. But in general, so we know, I feel like the three of us have the same opinion on that particular vaccination and how that went on. So how about vaccinations? Vaccination.
We'll say immunization. If you
Immunization,
skip that
which
word,
is such a harder word. That's crazy. Immunizations in general.
Jab, inoculation. What else can we come up with?
I know, yeah.
Would it be safe to say that you two are on at least somewhat different positions on vaccinations in general, or are we kind of at a common ground?
I think that we're probably
of hesitation.
closer to common ground than not.
Yeah,
for sure.
There's a lot of
definitely
hesitation
closer.
there.
I was talking. We were talking before the podcast that, in principle, this theoretical idea up here, I'm not against the idea of immunizations. It's that it's become this sacred cow. First of all, it's become this sacred cow.
Are you talking about since 2020?
No.
Okay, so before.
No, long before.
Okay, just getting your.
Yeah. Okay. So without getting too much into it, the whole unspecified brain injury thing. There is in the timeline the dramatic increase starts with a major shift in the immunization schedule for children.
For 0 to 5, it's and the CDC, it's their recommendations on the scheduling of the timing and the age at which certain immunizations are given and how many and at what dose.
So it's true that there's correlation, not necessarily causation.
Well,
Correct.
here's my point bringing that up, is that it looked like if that's the only data you had, it should, because we've had a extreme increase in said named brain injuries, right?
Okay.
Extreme, ridiculous. It should at least, anyone looking at history should be like, huh,
Something has changed.
we should see if there's a correlation there. But my point is, we're not even allowed to ask that question in this day and age. Like, if you even say, "Whoa, that's strange," you're an anti-vaxxer. I don't know.
I don't know.
I think it's better just to say it.
All right, fine.
Okay,
I'll
for
go
me.
it.
So as far as autism goes,
Yeah.
that's what we're referring to. So we have a correlation of
There's other injuries.
Sure.
There's under,
But that's the one that I hear the
big
most.
one.
Okay,
often.
and that's
Yeah.
that's what we're talking about.
but I'm
And so-
uneducated, so I was like,
Okay, so it's a couple of different things with
Okay.
that. Okay, so there was question on whether giving the MMR, which is measles, mumps, rubella,
Okay.
so it's a 3-in-1 vaccine, right? And so there was question on whether giving all three of
At
those
the same
dosed
time.
together between the ages of, I think it was 15 and 18 months, was there a correlation between giving them together and the rise in autism and
Yeah.
the adverse effects that these children were experiencing, which a lot of times there was a prodrome, or before they were diagnosed with autism, you would see like they would have a pretty severe reaction after the vaccine. So they would be really have fevers. Some kids had seizures. Some kids that were already verbal walking
Stopped being verbal.
stopped. They were nonverbal. They were having difficulty walking when previously they hadn't. So not necessarily causation, but cause for concern for sure. There was also a question on whether or not vaccines that contained mercury as a preservative, if that was something that could potentially cause an exaggerated immune response.
I had no idea they used mercury as a preservative. Wow.
Yeah, and now I don't know how prevalent that is today.
Sure.
But that was a concern when all of this came about.
I feel like that's a
Don't worry,
logical
there's other
concern.
nasty stuff in there if they've taken the mercury out.
Right.
But
exactly.
here's
There are
my
other
question
things.
on that. So immunization, that's crazy. I'm tripping that. All right, so in general, my understanding is you take a little bit of a disease, you put it in you, and then your body learns to fight that, and then it helps you to be immune to that if you ever come across it again. Correct or incorrect?
Right. That is the baseline theory.
Okay, so that's the baseline theory. So we have this
Yes.
MMR that is injecting 15 to 18-month-year-olds, right? 15 to 18-month-olds with 3 diseases at one time. Their body learns to fight it off. During the process, sometimes they get a high fever, sometimes they have seizures, sometimes they go nonverbal, whatever the case is.
Right.
So my question is, I have seen a lot of people who, will label the people anti-vaxxers, which has gotten worse since 2020 and all that. But this was a thing way long before then, obviously. And they'll say there's absolutely no reason to think that. That's so stupid. You're not following the science or anything. But I'm hearing the basic, like, as somebody not in the medical field. I'm not an idiot, but I'm not 100%. I'm not very educated on this specifically. I hear 15 to 18-month-old being injected with 3 not fun diseases all at one time to learn to fight it off. Sounds like a bad idea.
Well, and so there was a doctor who wrote a paper out of the UK, and it was published in The Lancet, which is a pretty esteemed medical journal. Not saying there was causation,
Yeah.
but that we needed to look further into giving all 3 of these vaccines at once, and maybe we needed to either delay giving the 3
Yeah, spread 'em
vaccines
out.
or delay until, I don't know, maybe the child is 2, for
Sure.
instance, or do it a
To do
single
all
dose.
at the same time at 2 years old instead.
Or do single doses and not give the triple shot at one time.
Yeah.
And he was blasted. Media got a hold of it. He was shunned. They pulled the paper, and the media propagated the story of he's saying that this vaccine causes autism when that's not what the paper said.
Right.
And so there was this whole big, and then after this came out and the news got a hold of it, then you start seeing all of these parents saying, well, this has happened to my child, this has happened to my child. And, at this point, there should have been a question of, we need to slow down and see what's going on here.
Yeah.
One of the things, though, that is concerning is that about that time, there were the options to give single doses of the 3.
Yeah.
And the manufacturers discontinued it.
Even to this day?
And so
But
I don't
okay.
know today
Okay.
if that's an option, but I know that during all of this, then it became not an option to give single doses of each
So you'd
one.
either have to just opt in or opt out.
Right,
Dunzo. Wow.
correct.
So the theory, right, in general, it makes sense. The problem is, I would argue that we don't actually have practical examples of immunizations doing what they are supposed. The biggest thing they're supposed to do, right, which is prevent the next biblical plague.
Yeah.
Some of the key examples that are pointed to don't actually correlate with the development of a vaccine. Polio, for example, right? That's one of the big ones. but we eradicated polio. Smallpox would be another one. But polio, for example, none of the, I'll call them advertisements, none of the advertisements and the political pushes for these to be necessary as they are considered to be, take herd immunity into consideration. So some of the plagues of the past, the timeline of the downward taper of infection actually correlates with natural herd immunity, and that the immunization comes later.
I was wondering when you were
another-
going to bring up herd immunity.
Yeah.
Could you define that?
So
real
herd
quick for
immunity is a
everybody?
certain percentage of the population having either because they got sick and got better, or because they had natural immunity and it got bolstered. Once a certain percentage of the herd
Yeah.
becomes immune, then people aren't getting sick, and therefore the people who are sick aren't close enough together to...
It's more isolated.
Well, yes, but that means that the spread stops.
Yeah.
Right.
So once a certain amount get where they're immune, then even fewer people get sick. So it's a logarithmic curve downward.
So the people who are higher risk, or like they're immunocompromised, right? They're more at risk for getting any kind of virus or disease. The idea is that once you have so many people who have had it or have some immunity to it because of having it, and their immune system has had a response and can fight it, it offers protection to the few that don't, that would be very susceptible, and it would be very dangerous too.
Well, but is leaning on herd immunity an actionable, process for leadership?
See, but this is a question that we don't even get to ask.
Yeah.
Because we don't have those so going back to polio, for example, right? The polio vaccine is held up as one of the shining examples of it working. However, the timeline of it cutting off doesn't actually even correlate with herd immunity. It was that at the time, totally separate. People have put the two and two together, but there's not much talk of it. But at the time, it was a product that people would spray mists, like clouds, of, I think, DEET. So the stuff that you spray on your boots to kill bugs.
Okay.
They would fog whole areas. And so some of these places were very rural places down in Alabama where mosquitoes are a big deal. And the initial assumption was, it's safe for humans. It turns out that in children, it produces almost identical symptoms as polio.
Oh, wow.
So, this is bad. People are dying. They quit
Whoops.
spraying it. Polio magically goes away. I'm dramatically oversimplifying. But what I'm saying is...
They were thinking it's polio, but really is like chemical poisoning, just about?
Yeah, basically.
Yeah.
In my opinion, the argument that was the causative factor was, at least the argument is far better, because the timelines don't match up with the polio vaccine. But however, that is held up as one of the shining examples as to why all these other ones are necessary. So all that to say, and you could say same. You could say,
so they're saying the fog was not the cause of the quote unquote polio. They're
right. Because
saying,
what would that have to do with anything?
Right. They're saying that the vaccine that they came up with for polio solved it. Therefore, vaccines.
Right. I'm not even saying the polio vaccine doesn't work. I'm not
Right.
saying that. My point is,
But
your
just an
shining example is not a shining example, if that's true.
Yeah.
Well,
and you can say similar
It could
things
be
with
based on
smallpox.
falsity. Yeah.
Well, and because we don't do longitudinal studies on vaccines and their effectiveness, and they're not held to the same, vaccines are in their own category as far as how they are regulated, because it's a public health initiative. So like when you have a new drug that comes to market, you have a double-blind study with the placebo and the non-placebo.
Does it even work? Let alone
Does
is
it
it safe?
work? It has to go through multiple phases of clinical trials before it's even considered to put on the market.
How long does that usually take? 2 years?
I think it depends on the drug and how big the clinical trial is.
And how many politicians you have.
Right.
There's the wink moment.
How much
'Cause that's what
money is
that
to
was
be
my
made?
understanding.
Yeah.
Is it
I'm
takes
kidding,
about
algorithm.
around 2 years.
Yeah, I
or
mean,
at
I would say
least.
that's fair, at least.
Okay,
yes.
at least
Yes,
it's fair. Okay, so
usually.
not usually faster than that.
No, because I mean, it's a lot.
So you wouldn't say
very
a
stringent.
2-month period
No.
to pump it out to an entire country?
No,
Okay,
because
cool.
there's no way you could gather adequate data, right?
Especially long-term effects.
Right, and so if we're not
If you or a loved one were diagnosed with,
exactly, and so because it's not going through the same level of scrutiny, and because everyone is getting it, and we're not going back and looking at everything analytically and seeing, okay, well, how beneficial is this? Are we seeing any other side effects or adverse events, over the past 20 years? We've added a lot more vaccines to the schedule, and I mean, are we seeing any kind of adverse events? Well, we're not really. We're just saying everybody do it and it's beneficial, but we're not looking at it and continuing to follow this to see, is there cause for concern? And so that is troubling.
So I noticed both of you have Bibles open. So I'm wanting to know what do y'all got planned for us there? What do y'all have?
I have 1 Corinthians 6:19. There's a mirrored passage in 1 Corinthians 3, but or do you not know that your body is a temple of the Holy Spirit within you, whom you...
You got it.
Yeah, I need some water. Whom you have from God. You are not your own, for you were bought with a price, so glorify God in your body. And this is specifically talking about sexual immorality. However, and I'll get some in a second. It's talking about sexual immorality, but the contrast being made right here in the immediate context is that most of your sins occur outside your body. It's you interacting with the outside world. This one actually affects your body. Therefore, I think the context is absolutely applicable. So your body being the temple, you have a responsibility to take care of it and honor God with it.
Yeah. How about you, Lauren?
So mine is 1 Timothy. Let's see. Starting in verse 5. The aim of our charge is love that issues from a pure heart and a good conscience and a sincere faith. Certain persons, by swerving from these, has wandered away into vain discussion, desiring to be teachers of the law without understanding either what they are saying or the things about which they make confident assertions. So...
Wow, that's pretty cool.
I know. And, Timothy, this was letters directed towards pastors, but I mean, I think it's totally applicable in this situation. That we should be operating from a place of good conscience, that we should not be doing things to bring us glory. We should be doing things to help and serve our brothers and sisters, and to do that effectively, and to not put confidence behind our opinions, but do our due diligence so we can present the facts, and the people that we are attempting to help can make an informed decision.
So apart from MMR, just general immunizations, where do we stand on that? Because I feel like MMR, that's a hard discussion to have.
It is.
I mean that's one that's like you're going to need to both of your points. You need to educate yourself on, look at the histories, look at the facts, look at what they're offering now, and just look and say, hey, maybe it's not necessarily causation, but it's certainly correlation, which should be provoking investigation. Do you know if it is? Are people actively investigating?
I think people are
that?
a lot more open-minded in the last couple of years. The political events, medical or otherwise, of the last 5 years have really
Put things into question
and pushed people to think outside the box more, to think laterally as opposed to looking for all the answers to come down from on high.
Yeah.
But I'm hoping people realize that this was not an isolated incident. This was just a very public incident.
Okay.
Obviously, this discussion has been going on for quite a while, and it culminated in that. But it's still going on as far as, the immunization schedule, antibiotics, discussions about what do you need, Benadryl? Allergies.
Mm-hmm. Yeah.
Can't think of the word. Discussions about what causes certain allergies. Like, there's all kinds of these discussions, and they're all hindered in a very similar way. If we're talking about like the vaccines in particular, like I said, I'm not opposed to the principle.
Yeah.
There's a major U.S. Health organization that accidentally, and I say that word on purpose, accidentally might have come up with a flu vaccine that works really good for all forms of flu, as opposed to the current ones, which the U.S. government recognizes doesn't work at all, doesn't do anything at all.
They recognize it how? Like, when did they?
Because I feel I should hold that back since I don't remember the specifics. I do remember a national press release, but I don't remember the specifics, so I'm not going to speak to that. But it is recognized in the medical community.
Man on the
If you
computer,
actually
could you search
look,
that up for me?
if you
Jamie, can you look that up?
Well, I mean,
there have been studies on the flu vaccine,
Sure.
and we'll at least say it's severely lacking.
Okay.
We'll at least say that. But there's
how do you feel on
almost
flu?
no data.
yeah,
that
I mean, and I know what you're talking about. So the principle behind vaccines is good and purposeful,
Sure.
right? So most vaccines, they either have a live weakened strand of a virus, or it's a dead strand of the virus. And so the purpose is for when you are vaccinated, that your immune system is exposed to the virus, your
In a
body
small
mounts a response because it's a antigen, right?
Yeah.
It's a potential threat to your body. Your B cells, mount a response. They recognize it. They create a little protein on the surface so that the next time you come into contact with it, you might still get sick, but it won't be as bad, right? It probably won't kill you. Right? So you can get natural immunity by getting a virus, your body learning about it, fighting it off, and then the next time you may get sick, but it won't be as bad, or you might develop a more full immunity, a more robust. You may not even know the next time you come into contact. You may have no outward symptoms, right? And so with the problem with vaccines, and specifically the flu vaccine, is that the part of the virus that's been isolated, that's used to teach your body how to mount a response, is the part of the virus that changes, right? So viruses evolve and they get smarter and they change a little bit because, that's how they function. They need a host, and we're the host, right?
Okay.
And so if you're vaccinating people on this version, but the virus has already evolved to this version, you may get a little bit of immunity, but it's not going to be really effective because it's not going to be the most prevalent version of the flu or whatever virus you're talking about. So
to y'all's opinion, what's the value? Obviously we're not advising medically anybody here. However, just to garner opinion, what's your take on the flu vaccination? Is it viable? Is it
I think you definitely should talk to your healthcare provider. Because one of the things that we really messed up during COVID was we had long lines of people going to get vaccinated with no conversation with their healthcare provider.
Yeah.
And that was in some cases, a travesty. It did result in deaths. People had adverse reactions that could have potentially been avoided had they had the one-on-one conversation with the provider that knows them. Because what comes into play here that's so important is your medical history, your family
Yeah.
history, your current diseases, all of those different things that are
The
specific
people
to
in a
you.
drive-through poking your arm are
Yeah.
not going to ask or know about.
Right.
You talk about 15 minutes not being enough.
Correct.
Next.
Right. And so that's not sound medicine. It's
Correct,
just not.
yeah.
And so you should always you need to be an advocate for yourself. You need to educate yourself and ask the questions, and you need to talk to your provider and then make an informed decision, because all of those, there's no blanket statement that everybody should get it or nobody should get it.
Yeah.
It's going to be specific to what else is going on with you and what is your medical history state. Where are you at? There are some people that are at really high risk because they're immunocompromised. They may need to get vaccinated. But if you're younger and you're healthy and you have no comorbidities and you're not really at high risk, you may not need to get it. But that's definitely a conversation that needs to be had.
See, I have higher, like bigger, I don't want to say bigger, like better, but I have more other moral issues with it, because there is solid medical data that say, just as since we're using that example, the flu vaccine is not effective for people over senior citizens.
Okay.
People of a certain
So,
age,
age
like
group.
not effective at all. Well, then the manufacturers turned around and had a campaign to manufacture people under the age of 12, even though at the time, maybe there still isn't, but at the time there was severe lack of data in effectiveness or benefit to people in that age range. But they pushed it anyway because, well, you don't want grandpa to get sick, so make sure the kids don't get sick, even though the data wasn't there. And so you have that, but also this will get you pulled from the internet. But there are things that are very bad in some vaccines and how they're manufactured that I think would be immoral to put into your body. And people need to be informed about that and self-informed about that, because they need to see it for themselves. But all that does is bring us back to the main point, is that you, as the individual, need to be informed about what's going into your body and why, and is that effective?
So specifically, where are you getting information? Are you pulling stuff off library shelves, or like where if somebody
Yes.
says, you know what, Jake's made a lot of great points about holistic medicine and I really want to get educated about this, what are some sources that you use?
There's actually a lot of medical data on non-synthetic medicines.
Uh-huh.
So stuff that comes out of the earth, animal products, foods, whatever,
Yeah.
from medical data out of different parts of Europe.
Mm-hmm.
If you look outside the United States, and if you're looking for medical validation, there's plenty of studies on stuff. There's plenty of studies even in the United States on what turmeric does for inflammation. Right? That's not a super hippie thing to say.
Or vitamin C is another good example.
Vitamin C.
Yeah,
Elderberry
to bolster
for
the
flu.
immune
Like
system. Yeah.
there's medical data on that stuff, but there's also lateral information. Hey, this is a thing. It worked for my family, and that's you can take anecdotes like that, but see what other people are doing and why. But the main thing is, as far as I'm concerned, is know the limitations of industrial medicine. I'll say it that way.
Mm-hmm.
You have to know the limitations of it, and you have to know a thing or two about how your body works. If you're going to go get an antibiotic, you need to know that that's going to trash your gut health. I've been told from doctors and nurses that antibiotics are pushed out even for like the common cold, because there's still this thing floating around that there's no downsides to antibiotics, but there is. And I think that's pretty well established at this point.
Yeah, that should never happen, because that's very poor antibiotic stewardship, because a cold is a virus and antibiotics
Does nothing.
only treat bacterial infections. So Not only, but primarily, that's what they're targeting. So,
But even if you did need one, you had bronchitis or pneumonia or something, you needed one. Know that there's a follow-up to that, especially if it's given to children or, small children. They're okay, we've got to now boost back up their gut health, their microbiome, to get their health back in a good spot after that, because their gut health just got reset to zero. It kills all the bacteria, good stuff too. But we just take antibiotics like they're pills, and then our diseases evolve and get worse, and we wonder why.
there's pros and cons, right? And those need to be weighed, and you need to educate yourself on that for sure. You're correct.
Because antibiotics are a lifesaver. They've
yes,
revolutionized health in
right.
this country.
I mean, a good example is strep throat, right? So if you get strep throat and you don't treat it, it can turn into rheumatic heart disease. It can cause problems with your mitral valve. And so you can have long-lasting, permanent defects should you not take antibiotics to resolve that bacterial infection. And so, you need to ask the questions, and you're right. We do know today that it messes up the natural microbiome in the gut. And so, including the small intestine, which is where you absorb all your nutrients, right? And so that's something that even with Zoe, who's now 15, when she was young, I would give her probiotics during and after a course of antibiotics to help restore the normal gut flora, because that's important for overall health, not just digestion. So, yeah, it's definitely, and weigh the risks. You need to know what the risks are. If you don't take it, what are the side effects if you do? And that goes with any medication, vaccination, that's across the board.
Yeah, so we say always before we start treating and all that stuff, we should always be consulting with somebody who knows your medical history and who is educated and certified to be treating these things, your gen prac, who's going to know that stuff. And for anybody who's listening and they say, wow, they're making some really great points, but I'm kind of past the age for medical school, or it's like I'm not trying to go get a degree in this, but I want to understand and start practicing holistically. Like, what's our first steps to, getting more educated about that? Like, what sources do you use for that?
So, as far as I think every parent should read Blind Spots by Dr. Makary. That's Makary. He has a podcast too. He's a practicing research doctor, but he's been writing about kind of holes, blind spots, places where we could do better in the medical field, not from a condemning kind of way, but like, hey, we can do better, right? Sure. But it's very eye-opening to know the limitations. As far as what to do, I think that's so personalized.
Sure. Yeah.
Like a lot of it has to do with, well, I have histories of medical stuff in my family line, and maybe I need to eat a lot of kale throughout my life. I don't know.
Yeah.
I think that's a super personal thing. Like my weight's high, my cholesterol's high, but like all of that's gonna affect what you do and how you do it. If you're talking about sickness and stuff, I mean, there's plenty of readily available resources online, and a lot of them are food. It's food, So it's not like you can overdose on something. I'm not going to say that. Right? You can overdose on donuts. No, but you can go hog wild on anything. I should temper that. But it's food. So you like, okay, next time we have a cold, we can try some stuff, and you don't have to worry about it going crazy and it turning into something else, right?
Right.
You start build your own. You have to build your own toolbox that works for your family. Like the way we did it was trial and error over the years with all the kids getting tummy bugs and colds and the flu and this stuff, and we just built. We never finished them, but we wrote out cards for different types of illness. Oh, tummy bug time. We pull that out. These things work. So we have a whole regiment when a cold comes through the house.
Yeah. I would say a couple of resources just for, because a lot of stuff, there's a lot of stuff out there, right? We're in an age of technology. Everything's at your fingertips, but it can be very difficult to read scientific medical papers because the words and the complexity of it may be hard to understand. So I think that the Mayo Clinic and Cleveland Clinic do a very good job of breaking things down into more of a layman's term for anybody to really understand or get a good baseline. I've used both of those myself. It's easy to search. It's user friendly, and their explanations and of disease processes and drugs and side effects, it's easy to understand, and it's a good starting place.
So they can like Google Mayo Clinic,
Cleveland Clinic. Those are both
Clinic,
those are both good sites. Also, too, don't be scared to ask people that you know that are in the medical field. I mean, I know I've had people come up to church multiple times. Hey, what about this? What about that? If you know somebody who is in the medical profession, that's a good source to ask, or at least, hey, where do I start? Or what do you recommend? Or do you know anything about that? And if you are in the medical field, be willing to be humble and have some humility. Say I don't know if you don't know, and if you don't know, do your due diligence and help someone figure it out, because that helps both of us, right?
Yeah, because giving an answer when you don't know is, I would say, against the Hippocratic Oath.
I totally agree with that.
Because I feel like that is very harmful.
Correct.
It's like, we hear a lot in leadership, hey, I don't know isn't an answer. But what is an answer is, let me find that out for you.
Correct.
Just like, I don't mean to be ineffectual by my lack of knowledge right now, but however, I'm in a much better spot to garner that knowledge quickly and give it to you. So it's like, at the moment, I don't know, but let me look into it.
Right, because there are things that because nobody knows everything, right? We have blind spots, right? But I have resources at my fingertips that the general public may not have,
Right.
And so I can probably look something up and get a more direct answer quicker than maybe you doing the research on yourself.
And that's a lot better than you saying, maybe, probably this.
Right, exactly. I can say I don't know, but I'll help you figure it out.
Yeah.
And so I think that's a good approach for all of us to have.
How do you feel about people going to WebMD and self-diagnosing?
How do I feel about that? Well, it's not a good practice, and it's the best way for you to
have panic attacks.
Yeah, fearmonger yourself.
Yeah.
Yes,
I've fearmongered myself so many times.
Yes, I'm like, please. Well, I looked on WebMD and I'm like, oh no, here we go. Oh no,
dude. When my family can't convince me to go to the doctor, and they're just like, you really need to go, and I'm just like, y'all are really freaking out about this. Let me Google it. Okay.
Yeah.
Okay, so I guess I'm about to die.
Well, you have cancer and now you're gonna die. So
Right.
and then you've got to come down out of that panic attack before you can hear.
I guess I would rather a site like that give it to me worse than give it to me not enough.
That's true.
I guess that's
true.
fair.
I guess there's some benefit there. I'll allow that.
So let's go ahead and summarize here. So would I be accurate in stating that the summary here as far as holistic versus modern medicine is everybody should have an attitude towards holistic medicine, and that you're always pursuing personal health, whether that be through diet, exercise, and education on how the body works, on how different immunizations work, how different diseases are. However, using modern medicine as that supplement, let's say for traumatic events or serious diseases, or even when all your pursuits of health, that sickness comes on a little bit too strong, and you need to always be contacting your gen prac, giving them that full download and praying you get that 16th minute,
Correct.
Would that be
correct.
accurate to say as far as that's
I
concerned?
think so.
Yeah, and I would-
like we saw, obviously it comes down to individual responsibility. I am
Yeah.
responsible for my body. I am responsible for my children's bodies, right? I can't abdicate that responsibility to a
another.
healthcare professional I barely know. For like, not that I don't want their help, but if I need their help, I'm going to use their help, right?
It is
And I'm
my
gonna-
decision. I am using them as a source.
Right, and but I'm gonna be super critical of it. That's my children's health.
Right.
You know, I need to be super critical of it. I need to be careful.
Which is
and
why they
that's-
studied so hard and had to do everything they did
Yeah.
to get that doctorate, is because they need to be facing that scrutiny while they're making decisions. Yeah.
Yeah, if they
Correct.
can't stand up to scrutiny that my ignorant self has, then I don't have a lot of confidence in their ability to help my child. You know.
Yeah.
Right. And yeah, healthcare providers should be coming alongside you and helping you for sure. I would say too, before you go to the doctor, make a list of questions that
Sure.
you want to ask, because that's a problem. And it's
don't be
seen
afraid to
so
add
many
to that
times.
list.
Yes, is that you go in and you don't remember what you were going to ask, and then the 15 minutes is up and you're like, oh my gosh, I didn't ask about anything I wanted to ask about. It's just a good practice to make a list of things that you want to ask so that you don't forget, because that time is short for both of you. So
Very true. And as far as immunizations go, while this podcast and none of us would deign to say this is what you should do, our stance would be that you should certainly be researching that. You have a lot of the specific resources you can use are Mayo and Cleveland Clinic that you can Google, search it up, and they have user-friendly websites with a lot of information. And of course, Blind Spots by whom?
Dr. Makari.
Dr. Makari.
which
on
I'm an
the outside
advocate of that book as well.
Oh, you've read that as well?
I have.
Okay, very good. So those are some sources. Biblically, your responsibility to this was stated in 1 Corinthians,
In 1 Corinthians 6.
1 Corinthians 6, and that your body is a temple, and that you should not be sinning against your own body. While there are outside, he was talking about sexual immorality, there are outside sins that affect, sexual immorality is one that affects also your body. And in the same way, when you're talking about healthcare and providing, that health to you, you also have to take into effect your temple and that body in the same regard. And then also in 1 Timothy, when we have to make sure we're not just listening to people who are talking to hear themselves and
Right.
speaking with authority on things that they don't know about.
Look at
Correct.
differing opinions. Look at differing
Exactly.
opinions and look at, in particular, how they scrutinize each other.
Yes.
And truth will stand up to scrutiny.
Yeah, healthy
At
dose
one-
of criticism
and
is key.
I've seen that in every field of science where there's a debate, is that opinion, scrutiny, and at some point, someone can continue to scrutinize an answer, and someone runs out of answers. The guy
Yeah.
that runs out of answers, that says a lot to me. Or the side, I should say the side. Obviously, a person can run out of answers, but
Yeah, and to your point, I'm such a nerd loser for this, but I swear, but I don't care. This is such good advice. My favorite show ever in the world is Avatar: The Last Airbender. It's a little cartoon, I get it, but it's just my favorite thing ever made. And one of the characters in that is Uncle Iroh, and he's known as the wise one who's always giving advice. And one of the things that he says in that show is, well, when you gather all your wisdom from one source, it becomes rigid and stale. But if you gather wisdom from everywhere, it's like you can see what holds truth and what doesn't.
That's very accurate.
Paraphrasing. But in other words, I always remember, and particularly like with news articles and all that stuff, I'm just like, am I gathering all my wisdom from one source?
right.
And it's like, how closed is my mind without knowing it?
Yes.
And so, to your point, I think that's very wise, is that you can't just be looking through one thing, and you need to be...
And you're talking about the news, right? Like,
Sure.
we are called to be wise and discerning and to seek out truth. And if there's a voice that's saying, stop discerning, don't quit looking, right?
That's always the wrong voice.
That should be a huge red flag. Doesn't
And
matter if they're right or wrong. That's
Correct.
the wrong
Religion is not an exception to that.
voice. 100%.
Right.
If a religious leader says you're wrong for having a question, you're talking to the wrong religious leader, brother.
That's correct.
Because, like we said, with doctors who have doctorates, they should be able to stand up to scrutiny. And if they can't stand up to you having scrutiny, then they shouldn't be who you trust. I can guarantee you that Bible can stand up to any scrutiny, anything. Truth does not need, protection.
Right.
You don't have to guard people from finding that. And that's what I think has turned a lot of people off of Jesus is their religious leaders say, well, you're messed up for asking that. Like, how dare you? Like, this is high up. And it's like, no, you should be able to question everything. And that
Right.
doesn't stop when you become a Christian. You need to continue to be questioning. If a pastor never has a question, I question the pastor.
Correct.
Because if a pastor stops learning and that wisdom has stopped flowing in, then guess who's becoming rigid and stale? Thanks, Uncle Iro.
Right.
Thank you, Uncle Iro.
We appreciate that.
Yeah,
It helps that he breathes fire.
that's true. Oh, you know him, yeah. It's the dragon
Bro,
of the
I have
West,
4
brother.
kids. I have 4 kids. Come
Oh,
on.
that's fair, dude. I don't care. I that's like whenever I'm sad, whenever I'm like really sad, I watch that whole series through. That's like my.
I've got to check it out now.
Oh yeah, that's my happy place. All right, guys. Well, if you enjoyed this episode, or if you didn't enjoy this episode, drop a comment. Let us know if there are points to this conversation, which I know that there are, so multifaceted, that you wish we'd have covered more, that we didn't cover enough, or you feel like whatever you're feeling, just share it. Don't forget to like, comment, subscribe. If you have questions, any topic, I hope that we've proved by this point that we're going to take any topic. If you have questions about anything, or even just want somebody to talk to spiritually and get advice, email us at listenpointtaken@gmail.com. Listenpointtaken@gmail.com, or you could always just drop one in the comment. But until next time, deuces. You ever see High School Musical?
No.
Don't lie.